From Tidal Health Group, this is Health Impressions, where we break down healthcare marketing strategies for consumer brands with industry experts. I'm your host, Bryan Cush. Evan, it's so great to have you on the show. Been looking forward to this for a while. I'd love you to just start out, kind of tell us a little bit about who you are and who you serve.
So I'm Evan Steele, founder and CEO of Rater8. Rater8 is a healthcare reputation management company with its roots in patient satisfaction surveys. So we look at Rater8 as one unified patient feedback platform, providing feedback from patients about their visits, both online and internal surveys. I've been in the healthcare IT business for 27 years. I started and owned an EHR company named SRS Health, which I sold in 2012, and I've been started up and been running Rater8 since 2015.
That's amazing. So you've clearly been around the block, and I think you'll have a lot of multifaceted experience around this. We really use the word authority a lot, whether we're talking about it in kind of service, what its definition means. I'd love from your experience and kind of where you're at now, like how do you define and what does the word authority mean to you in healthcare?
Well, so when it comes to marketing and SEO, authority is a very important concept. We all talk about website authority. So if you do your, implement SEO in your website correctly, you have a lot of content, all those keywords, you're doing everything right by the book, you're going to develop, have backlinks and whatnot, and dynamic content, you're going to generate website authority. So when patients do searches, organically, you'll come up first, second, third in those Google searches. But there's also a reputation authority, and that is Google, mostly Google. When you search for care in your market, let's say for an ophthalmologist or an orthopedic surgeon or a family practitioner, who's Google going to recommend? How much authority does your practice, your doctors, your brand, and your listings have such that Google will see that authority and then promote you over your competitors? So that's how we look at authority outside the website, but more on the reputation side, online reputation side.
Yeah, you made an interesting distinction there of I heard kind of separating reputation authority and web authority. How do you think about that? Are they mutually exclusive? Are they kind of in sequence? How do those two interplay?
It is interesting. I think mutually exclusive, you think of the Venn diagram. There's some overlap, because you have website authority, then there's reputation SEO, reputation authority, which which means you want to have a lot of reviews on your listings, a high star rating, a lot of content. Google scrapes. We'll get into this later, but Google scrapes their own listings for keyword matches, right? So you want to just make sure you're doing everything right on the listing side, including recency, right? You want to have reviews posted consistently, not wait months between reviews on a listing. And you also want to respond to reviews. So that's outside the Venn diagram, the non-overlapping part. The overlapping part is Google makes maps, websites and listings, believe it or not. So a doctor's listing is mapped. There's like a neural map in Google between a doctor's bio page and a doctor's Google listing. The location page, the location listing that Google has, and the location page on the website. And then they talk about things like name, address, phone number, where you like to match perfectly the doctor's name, first name, last name, comma, MD, or middle initial, exactly with the Google listing. And same thing with location, that the location on your website that you have for an office should match it. The address should be the Google Maps address, should be the exact match. So there's some connections between the website and website authority, and websites that have more regular SEO authority also that translate into reputation authority, online reputation authority. So there's definitely overlap.
Yeah, you just kind of drummed up an interesting experience I remember. And I don't know if you're directly talking about Knowledge Panel or if just like this is like implications of it, but it is something funny to your point of that. We had a scenario where there was a doctor, Bob Smith, and it's like how many hundreds of Bob Smiths are there as the doctor? And we had to find the distinguish of actually inserting his middle initial allowed him to kind of like separate himself from the crowd and make it clearer to that mapping, quote unquote, who that individual Bob Smith was.
Yep. And also location is key. There could be a lot of Bob Smiths, but if there's one in your area, I live up here in Bergen County, New Jersey. If I search for Bob Smith MD, even though it might be 100 of them around the country, Google's going to obviously know I'm here and this Bob Smith, his listing, he's nearby, and will pull up the correct Bob Smith for me. It gets more challenging if I'm looking for Bob Smith and I'm traveling somewhere and I want to see him, then I have trouble finding him. Um, but you're right. To make those links are very helpful between the website and your listings.
Yeah, is there anything more about that concept of mapping that you could dig into, that kind of what you're thinking about when trying to either directly support or kind of affect that mapping?
Oh, okay. So what we mean by mapping between the website and the listings is a name, address, phone number, right? That's a mapping. So Google will actually try to take the doctor's specific listing or the location listing and map it to a web page on the practice's website, right? And that connection apparently is valuable. Once that happens, and if you have high SEO value of the doctor's bio page, for example, and you combine that with mapped to a listing for the doctor, and there's a lot of ratings and a high star rating, a lot of responses to patient comments, a lot of good recency, a lot of reviews posted in the last 30 days, then all that whole ecosystem together is going to give you higher SEO scores, and Google's going to promote that doctor's listing over listings from other practices. And we've seen websites, they just have, let's say on a smaller practice site, you just have all the doctors listed on one page, right? So there's no separate page for the doctor. There's no way to map the doctor to the Google listing in Google's minds, in Google's network. And practices lose out on that reputation authority that way by not having those individual pages for each doctor.
Yeah, that sounds just like a really quick, interesting tip there, that just we look at it as kind of like entity relationships. That if you just have this big pool of doctors and they're asking you, like, should we have separate profiles? It sounds like your answer is always going to be yes. I've heard your team kind of use this statement a lot, and I'd love for you to just like dig in underneath what it means more. But you've said that the homepage has moved up a level in the patient journey. And I love this. I'd love to understand more.
Okay. So think about it. Everybody, anyone who's watching this podcast should just try right now searching for their brand, right? And if you have multiple offices close by, you just could type in like ABC Healthcare and then your address. And what happens is when a patient who's nearby that office types in your brand, Google search results are on the right side is the listing. It takes up the whole right side of the page. On a mobile device, it takes up the whole screen is the Google listing, the first screen. So the first thing the patient sees is the Google listing for the brand. And oftentimes you try it with your brand. If you see 3.8 stars and 46 reviews, you got a question of, what's that doing for your brand? I would never, ever, ever eat at a 3.8 star restaurant. I'm always looking for 4.5 or higher. Would I trust my life and my health and my family's care to a 3.8 star rated practice? So what we see is, hospitals, medical practices, they spend tons of money on marketing, on billboards and their website, print ads, signage at the local stadium, right? You see this all the time. And what that does is it gets the practice's name built into a person's mind, right? Front of mind, right? So now they need care. They type the name of this, let's call it a medical practice. They type ABC Orthopedics, and the first thing they see is 3.8 stars. So all that money invested in marketing spend to get the desired effect of someone typing your brand in Google, they want to call you. They don't know what your URL is. They're typing your name in Google, and boom, they see this 3.8 stars prominently displayed on the screen, and really the only thing they see on a mobile device. To me, that's inefficient, right? You can spend all this money. Like, you would never take that 3.8 star listing and put it on a billboard on the side of the road. You'd be embarrassed to do that. Yet, your online billboard, intent-based search, patient looking for this practice, is the first thing they see. So that's what I mean by like Google search results. It's your new It's your new billboard. It's really your online billboard. And just like you wouldn't put an ugly billboard up and brag about your 3.8 star reviews on a billboard on the side of the road, you should not do that on with your Google listings. I think it's so important, and that's kind of low-hanging fruit to fix that. And the same holds true for doctors as well. Search for a doctor in your practice has 6 reviews, 3.2 stars. It's the same thing. And I see a lot of billboards on the side of the road advertising doctors, right? They show the head doctor at a big subspecialty they're trying to promote. And again, patients will type that doctor in the browser and see something very different than what they thought they're going to see.
Yeah, that's so interesting. We preach that too in just a different way of always saying this kind of like your online footprint is this 24/7 sales agent, and you're potentially losing work and customers without you even being aware of it. It's fun. Do you find yourself still having to like have that education conversation that, okay, you can invest in your brand, but you also have to invest in your reputation, and people in healthcare are also consumers?
Yeah, I mean I get involved on the sales side, so I'm on demos, participating in demos, and that's where we provide, or we try to educate folks. We do 3 kinds of searches, right? It's a brand search, a doctor search, and a best near me search. Like every practice should do that. Search for your brand. What do you see? Search for your some of your doctors. What do you see? And then do a best near me search. So best gastroenterologist near me, best emergency room near me. Like what is Google promoting? And like I said, it's an education. There's lots of education that we need to do to get people to understand that patients are making these searches, and they could look at their listings data. They could see how many hundreds of thousands of impressions these listings are making in front of patients or prospective patients, and trying to make the neural connection, I used that term before, between their marketing spend and getting to their website, and trying to show them with those three types of searches, the brand, the doctor, and the local near me search, that there's oftentimes like a stick in the spoke. Like everything's working well with your marketing, your website's beautiful, but you screech to a halt with those online listings.
How do you think about affecting those kind of best near me, top doctor near me? Those are the holy grail of searches that person doesn't know you yet, but they've showed this intent. Like, how do you think about trying to show up for those types of queries?
So there's 2 parts. One is just the 4 R's. On your listings, look for the 4 R's: ratings, reviews, recency, and responses. Ratings, a lot of ratings. We talked about before, if I do best knee replacement surgeon near me, or like for plastic surgery, Botox is the gateway to more procedures, more Botox, and then eventually a facelift and other cosmetic surgery procedures. So how do you rank when someone says best Botox procedure or doctor near me, right? And the thing is, if I'm looking for knee replacement or Botox, the first R, reviews, you'll see, if I go type in right now, best knee replacement surgeon near me, you'll see Google's 3-pack, the 3 listings that they recommend. They'll actually bold the word knee replacement. They pull from the comments that have been posted in that listing, and they'll regurgitate it in those 3 listings they promote. So you'll see knee replacement or surgery. So Google is looking for keyword matches. So that's why lots of reviews with lots of comments. So there's more of a chance, more reviews, much more of a chance of the word Botox or the word knee replacement or hip replacement or endoscopy, more of a chance that it shows up in those comments. So lots of reviews is important. And also just having 1,000 reviews versus 200 is also valuable. Google's going to score you higher, and it also, creates trust and social proof among patients if they see 1,000 reviews. So that's ratings. Reviews. So ratings, the star rating. Whenever you do you could do it again. Type in best near me. Google's only going to show the ones with the highest ratings. They're not going to show any practices or doctors in the market, in the Google 3-pack results that have low star ratings when you search for best. So you're going to see the 4.7s, 4.8, 4.9 star ratings. So you got to have high star ratings. Otherwise, you're not even going to, if you have a 4.2, you're just not going to, if you're in a competitive market, you have a 4.2 star rating, you're just not going to be in those best search results, where obviously you want to be. Recency is important. There are articles Google writes about it where you want to keep your listings fresh, right? So a listing whose last review was posted 180 days ago is not going to score as high as if there's been a review posted in the last few days or a week. And then responses. Google also writes a great, they value engaging with customers, or in our case, patients. So to the extent that you respond to patients, Google loves that, and they're also going to score the listings higher. So there's those four things, the 4 Rs, help you get into that 3-pack, into the 3-pack and be promoted by Google. The other thing is number of listings. What you want, the best is 3-pack domination. We have your listing, and then 2 of your doctors are also listed in the 3-pack. And the only way to do that is to make sure you have doctor listings, so not for every office at which they practice medicine. So if you have a doctor in a satellite office and you're out, a half hour, 45 minutes from a main city, there's probably not a lot of competition there. There might be 1 or 2. If you could really build up the location reviews and the doctor reviews and do a good job, then you stand the chance of dominating, where best whatever near me, you're going to get the practice and 2 of the doctors, and now the patient, and all those listings look good, and the patient is not even going to consider your competitors because you're dominating that search result.
Yeah, you dropped a lot of knowledge in there. I'm going to try and parse out so much. There's one right at the end that I think you kind of explicitly answered, but it's one we get a lot around: should we create profiles for our providers? And it sounds like is there ever a scenario where you're recommending not to?
It's a pain to create the listings. We all know that Google doesn't support postcard mailing anymore. It's painful. So with larger practices that have multiple satellite offices where doctors rotate and sometimes go for a year here and keep moving, and maybe they see 5, 10, 15% of their patients at the satellite office, let's triage. Let's not focus on those listings, but let's create listings for where doctors are seeing patients, and they're seeing a good chunk of patients, especially in the suburban or rural areas, because again, that's where you get a chance to dominate. And also from a patient's perspective, think about, I'm a patient, and let me use an example in a city. I live in New York City area, so I live in a suburb in Bergen County. But if there's a town where a doctor sees the patient like 20 miles west of where I live, where it gets very rural, a patient might get the name of that doctor from a PCP or a friend or their Facebook group or their insurance guide. And now I say, boy, let me check out this doctor. So they type in the doctor's name. If the doctor doesn't have a listing, 20 minutes east of me for that office, Google's going to show the listing that's in the main office location where that doctor practices. And the patient might think, oh, I don't want to travel all the way over there. I want someone near me, right near me. So just by Googling that doctor and not seeing the doctor in their locale, you might lose that patient to your competitor. So create the listing so that when the patient searches for that doctor in that more rural area, they'll come right up. The listing will come up. They'll see the address and say, "Oh, that's right near me. I like it, and it has good star ratings. I'm booking an appointment." So kind of make it frictionless for a patient. Also, you'll be surprised if you don't have a listing in a satellite office, right? And the patient is in their car and they're ready to go to see the doctor. They type in the doctor name, click directions, and they get in their car. A lot of times they just end up at the main office because that's where they thought the doctor is. So now you're confusing patients by not having a listing for that location. So those factors plus 3-pack domination are all great reasons to have listings for the doctors, as many as you can.
Yeah, that makes complete sense. You started out, I think the first thing you said was really interesting too, because I was having lunch with a practice owner recently, and he was talking about how they feel they do a good job requesting for reviews, and they're getting reviews, but then they're just clicking 5 stars and they're writing nothing. And it seemed like you really put an emphasis on encouraging lengthier reviews and even particular language in their reviews. Is there anything that comes up that you think about, like how to encourage that, or anything that you do to help get content into the reviews themselves?
Um, we're very good at that, and it's interesting you brought that up. I've never actually thought about it, but um, when you're redirected to Google or Health Grades or Vitals, there's a little intervening screen. Patient clicks on Rate My Experience. An intervening screen says, "Tell your story," and it has like a Google logo, and then it has the little countdown, 5, 4, 3, 2, 1, and then it routes. So they get 5 seconds to read "Tell your story." So I often wonder if that's like, oh, I'll tell my story. You're going to get a couple more sentences out of the patient versus just, Google comes up and you could just put the stars in and not tell you a story.
Yeah, that's really interesting. I'm glad I was able to bring up a question maybe that you haven't always been hammered with. That it is funny that word story is. I wish I dated back behind it, but anecdotally, we do a fair amount of patient testimonials, and it's funny. One of like my favorite thing to do is actually interview the patient, and that's usually the framing is just go, "Hey, we just want you to tell your story. There's someone else out there that's probably experiencing just like you and may feel lost and wants to know." It's like, just tell us your story.
Yeah, so I want to back this up with data. We have the data. We do a lot of replacements of other vendors, just like other vendors, always have replacement stories. But it would be interesting to look at the percent or the average comment length pre-Rater8 and post-Rater8. It's all in our database. It's just a query. Be interesting. So we actually have that data. Just got to extract it from the database and calculate it. So I'm going to, now you have me going on a little research project after we're done.
Well, add some flair to that. I'd be curious how you think about because you made a really interesting connection point as well, is that the more the review matches the actual query, the better as well, because it'll bold it and highlight out.
If you do a survey first and then ask the patient to post a review in Google, you're going to lose a lot. It's without doing a survey, you skip a survey, you actually get 3.5 times more reviews than doing a survey first. So anytime you introduce workflows or clicks or messaging in between when the patient's ready to leave a review and when they land on Google to post a review, you get a drop off and you start decreasing the number of online reviews you get. And those are the 5-star reviews typically. So you get less ratings and lower average star ratings that way.
That makes a lot of sense too. I mean, that's just a little nugget there. It just sounds like less friction in the process.
Correct. That's the best way to do it, we find from our research. And we've done it many different ways over the years, and we find that the best results come from the most frictionless approach.
I want to recognize that we both are not lawyers at all, but I'm very curious to hear just if it's your experience or if you have anything direct to say. That we share our office with a law firm, so there's probably a proximity bias to where my head is with this, but there's so much swirling concern around responding to reviews. How do you think about that, from making sure it still happens, but just recognizing the fact that we're in healthcare?
Mm-hmm. So I have to preface this that I'm not a lawyer, and when I'm here to provide legal advice, and you need to obviously talk to your own lawyers before you respond to any reviews. But there's so many articles that you don't want to, even though the patient posted a review and even though the Google handle is their name oftentimes, so Bryan Cush, you don't want to mention the patient's name in your response, because we just don't want to acknowledge that the patient was there fully. So you don't want to mention, "Bryan, thank you for the feedback." We don't want to mention specific procedures. "Oh, we're sorry you had a problem with that endoscopy and that the anesthesia took too long to wear off," right? You don't want to mention those specific things. So, we have a templated system and an AI-based response system. So the templates, those are totally controllable and those are super clean. The AI responses also are super clean. But they tend to be longer responses than templated responses. And our AI prompt is just make sure that we don't talk about procedures, we don't mention any patients' names, and it's more like, "Thank you for the 5-star feedback," or "Thank you for the feedback, we appreciate it," or "I'm sorry you had an issue with your uh, an issue checking in, we'll talk to our staff about it. But again, we just don't want to mention names and procedures. So that's the challenge. The cleanest way is not to respond at all. But if you should respond, and you should just follow some basic guidelines to keep HIPAA compliant. And again, before you respond, you should check with your own counsel.
Yeah, I appreciate you taking a crack at the legal side. It's something we are far from as well, but inevitably always comes across our plate. It sounds like it, even though the response may be somewhat generic, the fact that you're building features and AI around this, it sounds like you are still heavily recommending to
Yes.
respond.
Yes, responding is totally important. And it's standard across healthcare. I mean, even the largest health systems with the biggest compliance and legal departments, they respond to reviews. It helps patients feel heard. It engages with patients. Don't forget, when you respond, the patient gets an email right away, right? So that has the response included with their review. So Google will send them that. It shows that they're feeling heard. It shows that you're listening, and it's super important to be engaged with your patients that way. Plus, if I'm a patient looking for a doctor or a practice, and I'm going to read their reviews, the fact that a practice responds to patients, even if I filter out the negative ones and I see thoughtful responses, I feel better. I feel like this practice, no one's perfect, but this practice is trying to do the best they can to improve their service.
No, I think that's a really important reminder. We're so technology and kind of data driven, just that kind of simple emotional response that, hey, I was heard and recognized is one to not overlook.
Right. And like we said, it's the fourth R. Google is going to promote your listings if you respond.
Another word we talk about a lot, and maybe you can add more, we've touched on a little bit, is just acquisition. It's like we've talked a little bit more directly to the authority side of listings and reviews. How do you think about it from an acquisition perspective of attracting new patients?
So we have numerous case studies. Recently, we posted one on our website with Balance Health, where they had a doctor and an associate, and they were trying to. It was a foot and ankle podiatry practice, and they're trying to increase the associates' bookings, right? So by building up, the doctor's very busy, and actually by building up the associates' reviews didn't have as much an effect as building up the main doctor's reviews, because that's who people were looking for, right? So they built up his reviews. They got so many more calls coming in from those reviews for the doctor, and he's so busy, his schedule is out 6-8 weeks, that they were able to grow the new associate schedule much more rapidly, because of the senior doctors Google listings and improving those scores. We also have just tons of case studies with our practices. Not every practice measures this, but a lot do, where they measure, a patient comes in, how did you hear about us? And they'll measure Google search, online search. And the numbers are staggering. We have one practice in New Jersey. It was an ophthalmology practice. They had 109 new patients per doctor more a year coming in through Google search, which is a lot. Our break-even ROI is, if you look at the cost of our software, just one new patient for a doctor a year. That's all you need to break even. And this practice was having 109. But one a week, 30, 40, 50, 60 is common as well. And it's just common sense, right? I do these searches. I search for doctors. I mean, my friends, my wife search for doctors for her parents. There are people now, because of COVID, there's a mobile workforce, right? So people are moving to different cities, and now they need a whole new set of doctors. I go to Florida. I spend some time in Florida because I can. We have a remote company, so now I need a doctor in Florida. Best near me search. That's exactly what I'm going to do. So the practice that's going to win my business, get me as a patient, is the one who's doing the best job and has a lot of reviews, and that I could feel like I could trust. And I would say, if I found I had two doctors on my list. One had 100 reviews, 4.9 stars, and one had 6 reviews, 3.8 stars. Even if the one with 100 reviews is a longer drive, and the appointment time wasn't as convenient for me, Like think back 20 years ago, 15 years ago, we'd book an appointment with a doctor who had the most convenient location and the most convenient appointment times. That was my only criteria. Now I don't care about any of that. I just want to see the doctor that has the highest reviews, that I trust, that has social proof online. So it's a big factor in patient selection of practices.
Yeah, you have an immense amount of data, and a lot of it doesn't surprise me, and I think probably wouldn't surprise listeners just around like how important reviews are. But I think some of those secondary order effects that you're talking about there of like, oh, nudging someone to travel a little further or being flexible on appointment time. And one that really blew my mind that your team shared with us was that 40% of patients would go out of their insurance network for doctors with more favorable reviews. Is there any more color around that? Because that's a question we get a lot too around how to even attract patients with certain insurance types.
Yeah, it just depends on uh, your insurance plan. Do you have an out-of-network option? The income profile of a patient. But again, it's my health. Am I going to trust a 3.2-star doctor or practice when there's somebody that has hundreds, or a lot of these practices now that the market's growing and getting mature, and a lot of these practices have been using these softwares for years now, with 1,000 or 2,000 reviews, it's 4.9 stars. Like, to me, that's worth going out of network. I'm saying to me or to some people, um, uh, especially if it's just about your health, right? And your life and your family's lives. So I think those are important. Social proof is a very, very important factor for sure.
Yeah, I think that, I mean, that to me just is there's so many marketing tactics and data and technology we can use to profile someone. And if you think about insurance, that's another, but something as simple as just make sure you're building a good reputation could affect the decision process of that potential patient. That to me is just, it was shocking to know that percentage.
Yeah. And there's another factor. Great example. There was a client of ours, St. Cloud Orthopedics. They were up in northern Minnesota, north of St. Paul. People could drive. It's not I forget what it was, like 45 minutes maybe or an hour to St. Paul. And I remember the admin telling me they grew patients. New patient growth was flat, and then it shot up after getting Rater8 because there are some really big and impressive orthopedic groups in Minneapolis. But if I'm living, let's say, a little bit south of St. Cloud, and I'm like a 30-minute, I could do 10, 15 minutes to St. Cloud or a 30, 45-minute drive to Minneapolis. If I'm seeing that my local, close, convenient orthopedic practice has great reviews, great. I'm so happy I'm going to go there. But if I have to drive another 15, 20 minutes because my nearby practice doesn't have online reviews and I'm not so sure and I'm not feeling good about them, but the one in Minneapolis has 1,000 reviews and I could get super comfortable, super quick with the doctors and I'm reading their reviews, and I'm going to make that extra drive. Like I said before, I'll go out of my way for a higher star practice. So they reversed that trend of patients in their area driving down to Minneapolis and going up and staying in the St. Cloud area by building an amazing online reviews for their practice and their doctors.
You dropped a lot of nuggets throughout this. I'm curious to just kind of open the door to just, is there any like kind of like top of the list tips and tricks you think about, especially around reviews and Google listings?
Well, it's not just Google. We've been talking only about Google. There's
Yeah.
the other review sites, Healthgrades, Vitals, WebMD, there's Facebook, a few clients like Rate8, there's Yelp. Healthgrades especially is something to look out for. I don't know if you've noticed, but when you type in best whatever specialty near me or PCP or family practitioner, pediatrician, in a lot of markets now, the very first set of search results are 8 or 10 doctors that come from Healthgrades, and it will show the first two. It says this doctor has 4.9 stars and 38 reviews. So the very first thing patients see are Healthgrades doctors, right? And you have to scroll down to see that 3-pack, the Google recommendations for the Google listings. So to me, a little nugget is Google's most important, we know that, but let's not forget about health grades. So you kind of need a software that understands this, or a company that understands this, that's going to build your location listings, your doctor personal listings, your doctor personal listings at the satellite office, your health grades, WebMD, vitals listings, has the flexibility to say, okay, health grade is more important than vitals and WebMD. Let me make sure a larger proportion, let me set my goals higher for health grades, so a larger proportion of patients will be sent to health grades than WebMD or vitals, but not as many as the Google listing, right? So you need to build up not just my Google listings, but there's a whole ecosystem of secondary review sites that are also important. And if you Google a practice, or a listing, a doctor, you'll see at the bottom of the listing, you scroll down a little bit, Google has reviews from the web, and they pull in health grades, vitals, WebMD. At Rater8, we have our own pages. They sometimes pull in Rater8 verified reviews pages. So we know Google is scraping and understands that a doctor's listing is associated with other healthcare review sites like health grades and vitals, and that they're importing it and bringing it into the Google listing. And I've seen studies where by building those secondary review sites, you also help your authority, your reputation authority. So it helps. So not, and I always say, if you have 1,250 reviews on your main office listing, what is the value? And you just had one posted this morning. What's the value of the 1,251st review? It's basically nothing, right? Much more valuable is to build the doctor's personal listing, or even let's go to health grades. And if they're at 18, let's get 19, 20, 21. Those are much more valuable than the 1,251st on the main Google listing. So the tip here is don't look at just Google listings at doctors and locations and brands. Look at the whole online listings for healthcare holistically as one ecosystem and one beast that needs to be fed.
Yeah, I think there's a really important lesson in there that I heard is that data and reputation management is a process, not a project. Because we often come across that where they're like, oh, we claimed our listings, we like ran for a month and got reviews, and then we stopped.
Yep. Yeah, and then you lose your third R, recency. You lose on those keywords. You lose the ability to respond to patients, and your star rating starts to drift down, because we know when you don't do anything, you don't come near the star rating as if you're proactively doing something. So then, those best near me searches, you're not coming up with the, if your star rating drifts down to 4.7 or 4.6, then don't appear in those best near me searches. So yeah, it's a what'd you say? It's not a project, it's a process. I love that. That's exactly frames what we're talking about in a perfect way.
Yeah, it's why you guys come up in a lot of our team's conversations too. Is like that's foundational to what we do. If we're running marketing campaigns or paid ads, like somewhere in the search journey, someone's coming across reviews. They want that validation. And if you don't have a process in place to continually approach that, we're not going to run the campaign because it's just we know we're going to have problems downstream. So we really preach that idea that like it's so common that they come in and go, oh, well, we had this groundswell effect and all the admin got reviews for a month and now we're tired of it and they stop.
Mm-hmm. Yep. So just like your website, everybody spends since 1990s, they're spending lots of money on their website SEO, their content, their dynamic content. They want their website to be growing, to be interesting every time Google crawls their website. There's reputation SEO, there's website SEO and reputation SEO. You want to do the same best practices that you do with your website to keep your website fresh and active and attractive to Google's search algorithms. You want to do the same thing with your Google listings and your other healthcare review site listings. Keep them fresh, respond to patients, get lots of reviews, star rating. It's the exact same thing that you need to do. And that's a process, as you well know, and it's not just a one-time project. It's a constant, you're constantly feeding that beast, right? A good SEO, you're constantly making adjustments to maximize your website SEO. Same thing on the reputation SEO side.
Well, I appreciate all the time, Evan, all the insights, all the nuggets. If people wanted to connect with you or learn more about your company, is there best ways to reach out?
Yeah, website is Rater8, Rater 8, number 8.com, or just email info@rater8.com.
Is there anywhere online that you're more active to if people just wanted to learn and kind of connect with you and your experience?
You can find me on LinkedIn, Evan Steele, Rater8. I'm always happy to connect.
Wonderful. I really appreciate the time, Evan, and hope you have a great rest of your day.
All right, Bryan, it was a great conversation. Thanks a lot.
Thanks for listening to Health Impressions. Subscribe on your favorite podcast platform so you never miss an episode. Leave a review to help us improve and connect with us on social media. Keep exploring, learning, and pushing boundaries. Tune in again soon.